Encouraging news on the COVID front. The number of people in the hospital that are not in the ICU has dropped in the past week, but the number of open ICU beds remains low. 3 beds are available in the metro, and it's a trend that we've seen for months as Delta grips hospitals across the state. Minnesota nurses are making another plea to the public and to their hospitals tonight. Our Rob Olson joins us live from the Minnesota Nurses Association. And Rob, nurses say the length of this crisis is taking a toll.
Yeah, they've been saying that, they thought they were maybe reaching the end of the crisis several times, only for to have it return and get worse again. The last month or two, they say, has been about as bad as they have seen it during the course of the pandemic. Their plea today, much like doctors last week, was for the public to take any precaution they can to stem the spread, but for also the administrators and the corporate owners of healthcare systems to do what they can to boost up staffing.
When you say the light at the end of the tunnel, right now I don't see that light.
Mary Turner just come off another weekend of caring for COVID patients in intensive care, which only fueled the emotion of her message.
This weekend, my ICU is full. Most of them won't make it. They're not making it anymore, folks.
As president of the Minnesota Nurses Association, she gathered 5 other nurses to share their stories of a perfect storm.
To be clear, COVID may have exacerbated this situation, but the health system leaders created it.
Their big picture plea is to healthcare administrators to fix a staffing crisis in nursing they say was a problem before the pandemic, but only made worse because of it.
Being on a ventilator on a hospital floor where the nurses are not trained to regularly work with ventilators is dangerous.
They are stretched thin, they say, and nurses are giving up.
We've watched RNs who can no longer mentally, physically, and emotionally tolerate the daily demands of short staffing and unsafe delivery of care simply to protect their license. They've also moved on.
Their more immediate plea is to the public either to get vaccinated, since the majority of their patients are not, or if you don't want the vaccine, to take other precautions to prevent the spread.
I personally know more people coming down with COVID in the last 6 months than I did in the first year and a half.
We can't get anybody better, and people just get worse, and there's no place for them to go.
Yeah, I asked them again, do they see any light at the end of the tunnel this time? And they said no, they'd like to, but they don't at this point. Hopeful that maybe that will come up again, but that they think that this is something that still remains a long haul. Live in St. Paul, Rob Olson, Fox 9.
All right.